Right, thank you, Anna. Thank you for the introduction. So we'll start with first an overview presentation, and after that we'll start the panel discussion. And thanks to the panelists for having accepted to be part of this panel. Before starting, let me join as well the general thanks and gratefulness addressed to THL and our hosts. Thank you very much for organizing the conference, and thank you for all your work in Sharp. So the presentation will essentially present the overview of the sustainability report. So we have disseminated this report for comment. Don't worry if you haven't had time to browse through it. This presentation will essentially present its overview, and we look forward to receiving your feedback on this report with a view to finalizing it as a deliverable of Sharp, so they're deliverable 4.2 of the work package 4. So work package 4 is concerned with sustainability. So that's one of the 4 core work packages, with 1 coordination, 2 communication, 3 evaluation. It is a standard work package across all joint actions, and its purpose, its objective is to help towards sustainability, which we defined as long-term uptake and implementation of the joint actions outcome. And this is indeed very important. And as most of our previous speakers in different work packages have already mentioned, sustainability is really a cross-cutting issue across all the work packages of Sharp. So first, so next, an overview of process we adopted in the conduct of this work. So first, we elaborated a sustainability guidance tool. So thanks to Christine, who elaborated this tool right at the very beginning of a joint action. So this was at its time an innovative process and or an innovative tool, which we have since used in other joint actions. We have used or we have adapted this tool in Terra, for instance, and we look forward to using it in other joint actions where we may be involved, such as Jamrai. And this tool, we wanted it to be undertaken at the very beginning to not only facilitate the process of sustainability, but more importantly, to reach a common understanding of sustainability and to ensure a general awareness of essential elements to consider for sustainability. And the objective of the tool, which I think, based on the presentations we've seen from all the work packages, has been achieved in the sense that all work packages have undertaken their work with a view towards sustainability. In all the presentations we've seen, and we are very happy that that's been the case. All the work has been done with a view towards achieving outcomes which do have a value and a relevance to be sustained. So our work really is cross-cutting and brings it all together within the work package 4, but it's really a joint undertaking across all the work package of this joint action. So following the sustainability guidance tool, we, along with our, thanks to the work of our Dutch colleagues, so thank you for that, undertook a selection of priority outcomes. So that was done on a basis of a self-selection, and we define a priority outcome as anything really, anything relevant to be sustained. So the view here changed a little bit with regards to what was initially envisaged. So a priority outcome, not just as a best practice, but anything really, be it a work method, be it a specific output or outcome, or indeed a higher level outcome, such as the eMERGE laboratory network in itself, which is not a specific deliverable, but a higher level functioning. And so we envisaged the priority outcome essentially as anything worth sustaining at the different levels, which we'll come to in a minute. And then the next step was to draft this report, which we have done. And the sustainability report therefore identifies or further refines the identification of a priority outcome, so packages them in a way which makes them sort of digestible or understandable to people not necessarily in the joint action, and also describes their rationale. So why are they important? Why are they relevant to be sustained? And what are the levels where the outcomes can be sustained, be it at the national level, EU level, regional level, in the pan-European sense, or the global level. And finally, the report proposes indicative, so not prescriptive, actions that can be taken, so practical steps that could be taken to ensure the sustainability of those outcomes. So this is an overview of priority outcomes from each work package. Here there's no surprise with regards to what has already been presented. So we had presentations from all the work packages, and essentially matches the presentations and the work that has been done, and taking out from the work key elements which have a particular relevance for to be sustained at the different levels, so national, EU, regional, and global. So this is present the overview of the different priority outcomes. So there are 10 of them from work package 5. So based on the work of our colleagues, we think that it's particularly relevant and the work they have done towards the methodology for improving IHR implementation. The work they have done in terms of cross-border collaboration. Regarding work package 6, we think it's particularly relevant the work they have done towards achieving a consensus regarding what constitutes a multi-sectoral approach. Work package 7, so the eMERGE network itself, which is a valuable function of SHARP. Work package 8 has undertaken training, so those are worth sustaining, but not just the training, but also the methodology to assess the needs. Work package 9, so we had the presentation of work package 9 and the recommendations regarding the setting up of a European Chemical Lab network, or as mentioned and completely in agreement, or is identified as a priority outcome that could relevantly be sustained. And work package 10, so work in progress, as Francesco presented, but the work here, the outcomes regarding the mapping of existing units and the implementation of a syndrome-based clinical protocol are as well identified as outcomes that could relevantly be sustained. So the report in itself presents, therefore, the summary. So this describes, in a succinct way, what has been done. So based on the different outputs, deliverables of work packages, describes why those outcomes are relevant. So why should we sustain those outcomes at the different levels? So national, EU, regional, global. So describing the policy context, so particularly at the EU regards to the health security framework, at the pan-European level regarding the work currently being done and to be undertaken regarding the Preparedness 2.0 strategy, and at the global level, looking at the work towards the revision of the IHR and the pandemic treaty. So essentially, the report presents what has been done, why should the outcomes be sustained, and what and how, essentially, what are the action items to be undertaken to sustain those outcomes. So we'll delve now a bit more in each of the priority outcomes. I won't read each slide. You'll have a leisure of perusing the report, but just for the sake of an overview, we'll just touch on each of the priority outcomes. So work package 5, thanks to the great work of our work package 5 colleagues, so they developed the methodology for a multi-country peer-to-peer approach for strengthening IHR implementation and evaluation. And as was already mentioned, I think Virginia mentioned it in her intervention, that very much links with the serious cross-border health threats regulation, particularly Article 7 and 8 regarding reporting and evaluation, but also Article 5 regarding the union plan, which actually specifically mentions undertaking CMEX and AARs, which can build on the work of Work Package 5 in this regard. And So that's the rationale at the EU level. There's also value at the national level because, of course, strengthening IHR implementation is an obligation or mandate under the IHR, and also relevance at the pan-European level, as we mentioned, but we can talk more about that in the panel regarding the new pan-European preparedness 2.0 strategy. So just get the next one. Right. Work Package 5 has also done, I believe, is quite important work building on actually the challenges of the COVID, which of course was a challenge in terms of implementation of the work, but can also be seen as a sort of real life challenge from which valid lessons can be learned, and building on that and different work they have done, looking towards so building towards a template agreement for cross-border multi-sectoral collaboration is also very relevant, linking with the Article 5, so the Union Plan, which envisages as well as a priority of having a cross-border collaboration as a priority. But of course, cross-border collaboration is not necessarily limited to the EU, so it could be also broader, and hence the relevance for the pan-European level as well. So that's the rationale for this outcome. So the next, regarding Work Package 6, our Dutch colleagues presented, and thanks again to Sandra, who's not here, but who we can acknowledge from a very valuable here work. So building a consensus or a science-based or evidence base for what could be or what are the core elements of a multi-sectoral approach to preparedness and risk response planning, and the tools towards implementing this multi-sectoral approach of exercises and the e-learning courses. So that as a whole, as a package, is identified as an important priority outcome with relevance here at all levels, because that's a shared priority or a shared aspect at all levels, be it national or EU, and indeed the cross-sectoral, the multi-sectoral approach is indeed identified as a core principle of the future Union Plan. And of course, member states as well are in the process, or different stages of process of strengthening their national plans and to integrate approaches, including multi-sectoral approaches. So building on this consensus approach, I think was mentioned, was building blocks. So building blocks which could help feed into this work through the HSC Technical Working Group on Preparedness, as was mentioned, which will be working towards the Union Plan. So that work could feed into this process, and I'm happy that this was already mentioned. And indeed, there's immediate, valid, and relevant use of this work in the short term. So we think that's a very important priority outcome in itself. Before moving to Work Package 7, just an overview, because Work Package 5 and 6, so they work towards, so regarding the priority outcomes that we mentioned, the general view is that there's a need to strengthen preparedness and risk response planning at all levels. Of course, as mentioned, there's the Union Plan, which will be drafted, is in the process, and is a new development based on the cross-border health threat regulation, but also at the national level, different countries are at different stages of strengthening their national plans based on the lessons learned, and to integrate these approaches, be it strengthening cross-border collaboration or multi-sectoral collaboration. But beyond those as well, there's also need to integrate other approaches, such as the One Health approach, based on echoing the discussions we just had before lunch, ensuring continuity of care, So there's a general need for ensuring a concerted and coordinated approach to strengthening national plans, and looking also as well at Article 6 of the cross-border health threat regulation provides for ensuring coherence between the national plans and the union plan. So this ongoing work provides an opportunity for strengthening preparedness and response planning at all levels to integrate these approaches, so in this case, based on the SHARP outcomes cross-border, multi-sectoral collaboration, but broadly strengthening national plans to integrate new and lessons learned from the COVID. Moving on to work package 7, not much to add based on the great presentation that was already done by our colleagues. Clearly the eMERGE network of laboratories presents a value in terms of the work that is undertaken and can be sustained as a EU reference lab based on application of Article 15. Already much has been said in terms of a process, so there's nothing particular to add to that. So clearly that's a valuable outcome from SHARP, which indeed has a value to be sustained. But beyond the EU as well, at the Euro level, there's indeed a value as well, because obviously highly pathogenic bacteria and viruses don't stop at the EU border. So there's a relevance for the pan-European level as well, and indeed at the global level, linking with the WHO Lyon office, who plans to be identify a global reference center for laboratories, and indeed strengthening laboratory capacities is a common priority identified at the global level in terms of strengthening preparedness and response to future crises. Moving on to priority outcome from work package 8. I think the two of them. One I think is the methodology itself. So the methodology used by our colleagues to identify the needs. So cross-cutting the self-reported needs based on the ECDC survey and cross-cutting that with the SPAR and the JEE tools, allowed to identify core capacities in terms of priority. So the methodology itself is a valid outcome or valuable in itself. And of course, linking with the overall work of work package 8, of particular relevance is Article 11 of the cross-border health threat regulation, providing for a strong mandate for the EU ECDC to undertake training, and that very much can feed into that as well, and at the national level as well. And looking at the other outcome from the work package 8, so the training itself, so the curricula, the exercises, essentially the stuff that was made or adapted from other sources to undertake the training, so that as well can be built upon. I think that was already mentioned by several speakers, and the training material could indeed be leveraged at the national level. So I understand some of the training material has already been translated, so could be adapted to national context, leveraged at the EU level through the ECDC or WHO ECDC Pro, DCDC training, or indeed WHO, and at the global level, indeed a strengthening capacity, so training of health personnel is also one of the other global priorities, common priorities identified at the global level, and indeed the WHO Academy, we can talk more about that in the panel, is envisaged as a key tool for training at the global level, and could indeed be used to sustain or leverage the work from work package 8 in terms of training. Looking at work package 9 as well, not much more to add regarding what has been presented. So there was essentially a scoping study looking forward to establishment of a European chemical laboratory network. And here the action items are essentially what the Work Package 9 proposed in the report as the next steps in terms of bringing forward the work that has been done in terms of a scoping study, and the need to undertake further work in terms of feasibility itself, looking at the technical aspects of this chemical laboratory network. And there's also immediate relevance linking with work, for example, from Joint Action Terror, which will look at the mapping of existing networks, so work we are involved in, and which we'll be sure to use based on use what SHARP has done in this regard. And regarding the rationale, is clear as well. So the chemical threats are addressed as part of the cross-border health threat regulations with the all-hazard approach under Article 2, as was mentioned, as well as under Article 20 of regulation. So regarding the SOPs on chemical health threats as well, so here work is ongoing, so work in progress, as was mentioned by our Work Package 9 colleagues. So we look forward to fleshing this part out based on the work that will be undertaken. But here the relevance of ensuring best practices to address gaps, bottlenecks regarding chemical health threats is clearly valid. So also as well regarding the rationale for all hazards approach as per the IHR. And here the scope for sustainability is both at the national level to adapt the SOPs and at the union level as well. So the union plan will address, or will have a all hazard approach based on the cross-border health threat regulation, and that could be a lever to sustain this outcome as well. And Work Package 9 as well, as was mentioned by Francesco, very much a work in progress, which we look forward to exploring, but the work done in terms of the mapping of the high-level isolation units and the expert clinical support service for high-consequence infectious disease is indeed a valuable outcome for from SHARP. So here the options for sustainability would be for ECDC and or WHO Euro indeed to update the mapping that will have been done, integrate the provisions for cross-border collaboration for high consequence infectious disease within the union plan, as we mentioned, with strong focus on which will have a strong focus on cross-border collaboration, and indeed over the longer term to update the mapping and to sustain this network. And from Work Package 10, as was mentioned by Francesco, again, work in progress, but a bit more so regarding the recommendations for a syndrome-based approach for early clinical management, so which again could be has value and could be sustained, adapted to national context, be sustained at the EU level through ECDC or through recommendations issued by WHO Europe. As a conclusion, just an overview of I would say three and a half levels, because there's three slices to the cake, but with a middle one. See the three levels which are relevant in terms of sustaining outcomes from SHARP, so the national, EU, and global level, and the EU indeed has value also looking at the new EU Global Health Strategy in terms of leveraging the EU assets and EU work, both at the regional level, in terms of a pan-European level through WHO Euro, but also at the global level to address issues of common concern, and indeed health security is a common concern, and leveraging those efforts at the global level. So indeed SHARP does fit into this view. So during the implementation of SHARP, if you compare the landscape before and after, it's really an unrecognizable landscape, right? Because COVID has had an impact, but beyond the challenges towards implementations themselves, they have caused major upheavals to the national, regional, and global frameworks for prevention, preparedness, and risk and response. Sustaining sharp outcomes, therefore, will contribute to strengthen the national, EU, pan-European, and global efforts for preparedness and response in support of common priorities that have been identified at all these levels. And indeed, among the commonalities, the common priorities, SHARP has addressed many of them, including strengthening preparedness and response evaluation, planning and core capacities, supporting cross-border collaborations, fostering multi-sectoral approaches, training and capacity building as well, laboratory capacity. So we tick indeed several boxes in terms of a common priorities at all these levels, and SHARP indeed has produced valuable outcomes in these aspects.